Morning. I thought I'd get off with a brief news update before I head in for an MRI on my knee. So let's start off with this post from Missouri Foundation for Health, and they're bragging about their public health policy and an article that was written by their senior director of public health. And I just thought I'd show you some of the folks that are actually working against helping to keep the healthcare costs down. And let's click on through and go to, this is Missouri Foundation for Health's website. And here's here's Clay Goddard. He's talking about his 25 years of experience and saying that he's been in the background most of the time, and he thinks now public health officials need to come out into forefront so that they can provide some leadership to get more people covered, get more people medical care. You can go through the link and read for yourself. But I just want to remind Clay Goddard of one thing, and that is this. This is a chart that was put out by Kaiser Foundation. Sorry, I had to click it up. And what you're looking at here is the growth in the profession, as the line represents the growth of U.S. healthcare. This tan line down here is the growth of physicians in the United States from 1970 to 2009, and this big yellow one here is the growth of administrators. So I have to disagree with Clay, and that the last thing we need are more administrators. In fact, we need to get them out of the business so that we can get the cost of healthcare down. And then I received this from the Insurance Journal. Insurer begins accepting cryptocurrency for premium payments. And this happens to be about the Michigan-based Universal Fire and Casualty Company, but I thought it'd be a good point to just make that all companies are going to start coming to offer cryptos and accepting cryptos. So if you haven't investigated them as a owner of a business who's paying premiums, I'd suggest you start taking a look in them just to get up to speed. And then from healthcare finance, we got this: hospitals are not complying with price transparency rule. And the article goes on to open up with the cost to disclose negotiated rates could be greater than the $300 a day fines in the JAMA study. So I hope they start compiling those lists and disclosing them, because this is one rule that's not going to go away, and it would, as I had said before, it would help bring down costs tremendously. But they go through a few of the expenses here and what the price differential is. This one is very interesting, though. Look at this. Since I'm going to get an MRI today, the mean range cash price for an MRI was $37.93, and for an ultrasound was $7.67. That, to me, is just shocking, because if you look at the spread here, it is $464 to $6,215. It's the same machine. No matter where you go, an MRI machine is an MRI machine. So I really hope they start giving us some access to information so that we can all be good consumers and purchase the best, most cost-effective care. And then lastly, I got this from Benefits Pro. Great magazine if you have questions and want to learn about the benefit business, but it says that the high deductible hurdle. Brokers can help employers and employees thrive by working with their clients to make the best out of their plan. So when we click on through to that, they're advocating that in this article that employers and the brokers who are consulting them should be offering not only high deductibles to help keep the costs down, but also zero or very low deductible plans. And I am going to disagree with my compatriots over at Benefits Pro. offering two plans does nothing but drive up claim cost, because what happens is the employees self-select on the plan, and they even go in to mention this here, how higher risk people will actually buy the lower deductible plans, because for them it helps them save money. They don't have to pay for that deductible. But what it also does is it deprives the plan of premium, because those people who are healthy and don't need the care, they're going to select the lower premium plan. So their good risk is not helping offset the poor risk. And that's why it actually hurts a health plan. So I would not recommend that an employer implement a dual option. I do believe you should have a low deductible plan, but not in conjunction with a high deductible plan. Well, that's all I have for now. I hope everything goes great for you all today. For me, it's going to be sitting in a tube or lying in a tube for 2 hours so I can have an MRI on my knee. So wish me luck. I won't grow bored. Anyway, have a great day. Talk to you soon.